Complications of brow lift surgery. There's resources on the website to discuss these in some more detail, and please discuss them with me. I'm just going to list them here for you in this short video. So in my practice I use multiple different kinds of brow lifts, and the choice of procedure accords to your anatomy and what we're trying to achieve. So I include endoscopic approaches as being the most common brow lift, but I use supraperiosteal approaches, skin wrinkle approaches, hairline approaches, temporal lifts, and corrugator ablation as part of some of the things that can be done in an individual case to improve the brow, hairline, and forehead appearance. So the following complications have been recognised in brow lift surgery, as well as the general complications that occur in any surgery. The most frequent adverse events in brow lift surgery I don't think are complications. They're essentially the risk of relapse, which is where there's always some degree of the brow dropping after surgery, even to a minor extent, and if it's too much then the brow should be further lifted. Or minor brow asymmetry I think is quite common in brow lifting and usually doesn't matter at all. If you look at most people, they have some degree of minor brow asymmetry, but it's something that should be discussed, and if it's an issue then it should be pre-discussed. The complications of the surgery can include permanent changes in skin sensation. So all brow lift techniques produce some temporary skin sensation change to the forehead or the top of the head. Sometimes planned permanent numbness can occur depending on the approach, and sometimes permanent numbness can persist where you don't really expect it to. None of this usually matters that much. Asymmetry or incorrect level of the brows. A brow lift can result in asymmetry or the brows positioned too low or too high. Hair problems. Some brow lifts can cause an elevated hairline, and some have a risk of causing hair loss. Nerve injury. So there's two motor nerves of importance in the brow called the frontal nerves, and they run up from in front of the ear to the frontalis muscle in the forehead, which raises your brows. Basically, brow lift operations are designed not to damage these, but injury to the nerves means you would no longer be able to voluntarily raise your brow. If the nerve's injured, further surgery may be necessary to elevate the brow. With corrugator muscle resection here, persistent corrugator muscle function is usually seen to a minor extent, but if it's seen too much, then it means that the surgery hasn't really worked. Infection, really uncommon in brow lifting, and scarring. With an endoscopic approach, there should be no visible scar, but with the open approaches, including hairline, wrinkle or brow, level brow lifts, then a scar that's more visible or unsightly than anticipated can occur.